Tuesday, the president promised a major announcement, and today we got it. The president signing an executive order to lower the cost of prescription drugs for sale in the United States, setting a 30-day deadline for drug makers to comply or face new limits on what the government will pay. Dr. Mark Siegel is a Fox News senior medical analyst and joins us now. Let me just play a little bit of what the president said as he was announcing this new executive order. Listen here.
What we're doing is equalizing. There's a new word that I came up with, which I think is probably the best word. We're going to equalize, where we're all going to pay the same. We're going to pay what Europe's going to pay. We're going to all pay. It's called most favored nation. We are going to pay the lowest price there is in the world. We will get whoever is paying the lowest price. That's the price that we're going to get.
All right, Doc, so the question to you is, other presidents have talked about lowering the cost of prescription drugs. They never really managed to do it to any great degree. Can President Trump get it done?
I think he's heading in the right direction here. First of all, there's a swell of popular support because this is getting worse and worse, John. Rand Corporation said in 2024, we're paying 3 times what similar countries are paying, 33 other countries are paying around the world. And the question is, you know, why and what to do about it. And it looks like he has some ideas that might have some traction. RFK Jr. just said on Fox Business that this will be extended not just to Medicare Part B, but also to Part D. And 78% of Medicare beneficiaries have Part D, 78%. And then he also said, RFK Jr., they're going to put muscle onto private, insurance. And there's a lot the feds can do, really, to regulate, through the FDA and to put pressure on. And then the president announced also that they're going to find other ways to decrease the amount of exportation of cheaper medication. So that would ensure that we get a fair shot at this. And another last thing is he has a policy in mind where people, presumably Medicare beneficiaries, can go right to the drug manufacturers for their meds and cut out the middleman. And we've spent a lot of time covering that. Pharmacy benefit managers suck up a profit and the prices go up.
Yeah. So RFK Jr., the HHS secretary, talking with the president this morning, said that this was an issue that's been radioactive, that nobody wanted to touch it. Listen to what he said.
I never thought that this would happen in my lifetime. I have a couple of kids who are Democrats, are big Bernie Sanders fans. And when I told them that this was going to happen, they had tears in their eyes.
Again, I mean, it's a great promise, but the devil is in the details and whether or not the president can actually get this done, because he tried to do something similar in his first term and it got enjoined by the courts.
Right, exactly. And at that point, that was only 50 drugs he was going after, Medicare Part B, chemotherapy, saying, look, you're getting that at the hospital. Why are we paying so much more for chemo than other countries? And you're right, the pharmaceutical companies fought back. RFK says that he's going to be meeting with them over the next month. But I agree with your point. They may very well not accept this. And, their prices on the market, stock market went down today. I would expect that there's going to be a battle in this. But the thing that the president and RFK are both saying is he knows the pharmaceutical lobbies are really powerful, but he's going to take them on. Again, devil in the details, as you said. Let's see. But it's something that the American public wants to happen because it drives up the cost of health care more than anything else, John.
Yeah, and the drug lobby is so powerful in this country. I remember back in the early 2000s. George W. Bush was trying to do something about this. There was a lot of talk about, well, let's buy our drugs from Canada. Let's buy them from overseas. And the drug companies said, no, you can't do that, because how can you guarantee the quality? You can only guarantee the quality of a medication if it's made in the United States. And these days, most of the precursors for our prescription drugs come from China. So it's like that argument is just so hypocritical.
That's over 90% come from China. And as you were talking, I thought of another thing that might be a fly in the ointment here. The countries that have a negotiating bloc, I know the president doesn't want to call it price controls, but the countries that have a negotiating bloc, because they have universal health insurance, have a way of negotiating that we can't do. We have Medicare and Medicaid, 40%. But, you know, the private insurers may not go along with this totally also, because that's another huge pharmaceutical lobby in Congress, right? The pharmaceutical lobby and the insurance lobby. So that's where the devil in the details comes out. What's going to actually happen? But it is good to see the federal government putting this pressure on.
All right, well, the president's winging his way to the Middle East. He's got a lot to think about and see if he can actually put this into practice. A lot of people out there are counting on him to do it. We'll see if he can. Doc, good to catch up with you. Thanks for the house call. Really appreciate it.